We are back and are going to shift gears from the holidays to your health. Age-related macular degeneration is the leading cause of vision loss, and the FDA has a new treatment. So for more information, tune into this great interview.
This is Christine Napier from Park City Television, and age-related macular degeneration is the leading cause of vision loss and is a growing health concern. It's estimated that 1.75 million people in the U.S. are living with the most severe type of the disease called wet age-related macular degeneration, or wet AMD. Here to talk about the impact of wet AMD and a new treatment option available for patients with the disease is Dr. Peter Kaiser, Director of the Cole Center for Ocular Research and Evaluation and Professor of Ophthalmology at the Cleveland Clinic. Thanks for talking with us today.
Thank you for having me.
So tell us a little more about wet AMD.
So wet age-related macular degeneration is the leading cause of blindness in patients over the age of 60 years. And what happens in the disease is you develop new blood vessels underneath your retina. The retina is like film in a camera. It's what you actually see with. So when these vessels develop, they bleed and they leak fluid, and that leads to a very sudden decrease in vision. Without treatment, you'll go legally blind. But thankfully, we have treatments for this disease that'll help prevent that.
So how can someone detect wet AMD, and what should they do if they notice a change in their vision?
So wet macular degeneration is always preceded by dry macular degeneration. The problem is dry macular degeneration is oftentimes asymptomatic. So really, someone over the age of 60 should be seeing their eye doctor once a year to either be diagnosed, or if they're diagnosed with dry macular degeneration, to be followed over time. Wet macular degeneration is a very sudden thing. So you may suddenly lose the ability to read, words are distorted on the page, faces may appear distorted, lines look crooked. In that situation, you need to be seen by your eye doctor very quickly. I'm talking about days, not weeks or months, because studies have shown that delaying treatment of wet macular degeneration leads to worse visual outcomes.
So tell us about this new treatment option approved by the FDA.
So our treatments for wet macular degeneration in the past were monthly or every other month treatment. This new treatment is called BioView and allows patients to be treated up to every 3 months, but with the same visual outcomes as the previously monthly or every other month treatments. So this dramatically reduces the treatment interval, but hopefully gives us similar results as our older therapies.
And why are dosing schedules so important?
Well, patients don't realize that this is not a 1 or 2 or 3 treatment problem. This is a lifelong disease, and therapy is required for years. Most of my patients really can't drive themselves in for their visits, so they need family members or friends to bring them to their visits. And say you're using a treatment that requires monthly therapy, you can imagine that it'll be very difficult for this caregiver to take off that much time. So invariably, patients would miss visits and miss treatments. And many of the real-world studies have shown that missing treatments reduces the visual acuity outcomes. In the case of this new drug, we will see patients up to 4 times a year. So it's unlikely that they'll miss a treatment. So hopefully this will translate into better visual outcomes in the future. That's why we're very excited about this drug.
Where can we get more information?
The best source of information on macular degeneration is going to be your eye doctor. They'll tell you about the diagnosis as well as the treatment, as well as side effects of treatment, including floaters, redness in the white part of the eye. But if you're on the internet, you can go to beoview.com, beovu.com, where they can get more information about the disease as well as this new treatment.
Will do. Well, thank you so much, Dr. Kaiser, for talking with us today. It's been an informative discussion.
Thank you for having us.